So let's talk about the research behind the audible contrast threshold. The ACT test finds its roots in the psychoacoustic measure known as spectrotemporal modulation. This innovative approach replicates the normal fluctuations present in speech, capturing both temporal fluctuations, so changes from syllable to syllable, and spectral variations, how the voice goes up at the end of a question, that are inherent in normal speech. Another way to describe these fluctuations is to use the term modulation. In the ACT test, instead of listening to speech signals, the patient listens to pink noise, which undergoes spectrotemporal modulation, prompting the client to identify modulated signals amidst non-modulated ones, resulting in that siren-like sound. Early tests with spectrotemporal modulation caused a lot of excitement in research, as those thresholds obtained demonstrated a strong correlation to advanced speech and noise tests that use a more complex multi-speaker setup, affirming that the spectrotemporal modulation results accurately predicted speech and noise measures. However, they found that those thresholds could only be established in 2 out of 3 clients with hearing loss. So this is where the Interacoustics Research Unit began their involvement in the test. To adjust for the challenges identified in the earliest studies of spectrotemporal modulation detection, Czar and colleagues altered the test procedure to be a 3 alternative forced choice task from a 2 alternative forced task. The 3 alternative forced choice means the participant only has to identify the oddball in a triplet of stimuli rather than remembering what the target signal is, which was required in the 2 alternative forced choice protocol. In addition, the presentation time was extended to make the task easier. Additional modifications were that the stimulus was presented bilaterally to better stimulate real-world situations, and the test stimuli was frequency shaped by considering the individual's audiogram to ensure audibility of the stimuli. Again, testing was completed to make sure this new signal corresponded to results obtained with advanced multi-speaker speech and noise tests. Further research was conducted by IRU to make sure the correlation remained with clients tested in languages other than English, and they found similar results, confirming the ACT test is language independent. The final leg of the journey was to make the spectrotemporal modulation test paradigm more clinically applicable, which became known as audible contrast threshold, or ACT. At this stage of development, the objectives were to reduce test duration, leverage existing equipment in audiology clinics, and preserve the benefits acquired in the research version to facilitate the adoption of the new tests by hearing care practitioners.